Good morning. I'm going to talk about urinary urgency and frequency today. And I'm going to preface this by saying what really brought this up and just kind of like lit my fire behind this is that I saw a commercial for a pill that's going to help, supposedly, with urinary urgency and frequency. And I'm not even saying it's not going to work. However, it kind of drives me crazy when that's what the public's being presented as a viable option, when actually I would argue that pelvic PT is a little bit more conservative and it's going to help you with like lifestyle changes that will actually fix the problem versus just kind of masking the symptoms, which is what a lot of those medications do. And a lot of people have great results with some medications. I feel like it's better, in my experience at least, it's better when patients kind of do both. And I have a lot of patients that don't do medications and still have great results with pelvic PT. So I'm just going to preface by saying that I think PTs need to make a freaking commercial that says, are you having urgency, frequency, incontinence, pain with sex? Try pelvic PT instead of like, try all these medications. So that's my TED Talk for this morning, but let's actually talk about urinary urgency and frequency, because that's probably why you're watching the video. There's a lot of things we can work on here. One thing, the muscles are involved, right? So we have, here's our pelvic floor. Y'all know I love the pelvis. And here's our pelvic floor, right? And here's our bladder. And our bladder sits right kind of in the pelvic floor, basically. And it's really close to these pelvic muscles. Okay, so the muscles, and I think I chatted about this briefly with our bladder pain video, but those muscles can play a role, right? If they're tight, irritated, just kind of uncoordinated, they can definitely put pressure on the urethra or just kind of affect that area. So that's definitely a component. But another thing pelvic PTs look at is what are the abdominals doing? What are the hips doing? What are the glutes doing? I mean, we try to look at the whole thing. Like, I don't even ever just look at the pelvis, right? I'm doing like hips and back and everything and all the things. So the muscles are kind of one component. But the other thing that I think people don't think about is the behavioral stuff, right? So there's lots of things that we might be doing that we don't know are contributing. The whole like peeing just in case. I think I did a post on that a while back. That's probably a whole nother video, but like we don't really want to be peeing just in case. We want to pee when we have to pee, right? Drinking enough water is a big component. I also have a post on that somewhere back there. So there's lots of other things other than medication and other than just the pelvis that might be playing a role in your symptoms. And if you're having urgency, you're having frequency, with or without the bladder pain I talked about a couple weeks ago, I would try pelvic PT. I mean, obviously I'm biased, but it freaking works, and with or without medication, but it's really getting to the root of your problem, right? We're fixing these issues so they don't come back, and so you're not on a medication for the rest of your life. If you have questions, leave them in the comments, DM me, all that good stuff I always say, and thanks for watching and listening to my little spiel about commercials. Thanks.